This is a video on the anatomy of the scapula and the clavicle. The scapula has an acromion, coracoid process, and glenoid fossa as some of its main parts. The acromion is located on the lateral angle, and it forms a joint with the acromial end of the clavicle, called the acromioclavicular joint. The coracoid process is the origin of the short head of the biceps, and the glenoid fossa forms a glenohumeral joint, which will be where the head of the humerus will fit into it, and it'll be a ball and socket type joint. The subscapular fossa is the origin of the subscapularis muscle, which is a part of the rotator cuff, one of the four muscles. The supraglenoid tubercle, which means above the glenoid fossa, is the origin of the long head of the biceps, and the infraglenoid tubercle, which means below the glenoid fossa, is the origin for the long head of the triceps. The supraspinous fossa and the infraspinous fossa are both in relation to the scapular spine, which is this white line that runs across and eventually forms into the acromion. The supraspinous fossa is the origin of the supraspinatus muscle, and the infraspinous fossa is the origin of the infraspinatus muscle, which are again another two of the rotator cuff muscles. There are also three borders and three angles of the scapula. There's a superior angle, a lateral angle, and an inferior angle. And there's also a superior border, a medial border, and a lateral border. On the superior border, there's a scapular notch, or the suprascapular notch, and this provides a passage for the suprascapular nerve that runs through it. There are two ends of the clavicle. There's an acromial end and a sternal end. The acromial end will form a joint with the acromion of the scapula. So the acromion will come round, and the acromial end of the clavicle will attach to the acromion, and that will form the acromioclavicular joint. And then the clavicle will run medially, and the sternal end of the clavicle will attach to the manubrium of the sternum. The conoid tubercles, they are the attachment for the conoid ligament, which is a part of the costoclavicular ligament. And the costal tuberosity is a site of attachment for the costoclavicular ligament as well.